Good day! My name is Glenda Trevino, and today we will be discussing the care of gastric feeding tubes for the Copper Queen Hospital. Our objectives are easy and simple. We're going to be discussing reasons for G-tubes, the care of G-tubes, identification of different types of G-tubes, and tips and considerations regarding your G-tubes. There are many reasons for a person to have a gastric tube. They can have injuries to the esophagus from chemical agents that they have ingested that has damaged their esophagus. They could have neurological injuries such as a CVA that has affected their ability to swallow. They may also have congenital diseases where their esophagus did not form. They can also have birth injuries such as cerebral palsy. They can develop other diseases such as multiple sclerosis, which prevents the swallowing of the esophagus. In some patients, even your Parkinson's patients, they lose the ability to swallow. They can also have throat and neck cancer where they have to have their esophagus removed for those cancers. So there's many reasons why a person would not be able to eat by mouth and would need to have nutrition by a different way, such as a gastric tube. When caring for a gastric tube, you're going to need to do daily care of the site. So in the step one of daily care, you need to gather your equipment. You're going to need gloves. You're going to need the appropriate cleaning agents. The doctor may have prescribed a certain type of cleaning agent for the site. If it hasn't been described and the patient isn't having any problems, you can use simple soap and water, a 4x4 gauze boat, some Q-tips, and a drain sponge. In step two, you're going to want to position your patient so the patient is comfortable, but you can fully see and visualize the gastric tube site. You want to avoid the patient being upright to the point where they have skin folds obscuring your vision of the site, so you can avoid pulling on the G-tube site. You want to also remove the old drain sponge and inspect the site. You want to check for redness, drainage, odor, skin breakdown. Don't forget to chart these in the patient's chart. You want to make sure you document accurately any problems you notice with that gastric tube site. You're going to want to use Q-tips to clean around the site, especially underneath the bumper. You want to remove any drainage, crusting, any irritations around the site. You want to use a circular motion, and you want to make sure you also clean the little bit of the stem of the gastric tube and also underneath the bumper. Use a circular motion. Make sure if you need to rinse the agent off the skin. Dry with 4x4 gauze to dry. You're going to apply the drain sponge underneath the bumper. If the sponge is needing to be secured, please make sure you secure this drain sponge to the skin. Make sure you check for adhesive injuries. You don't want the patient's skin to become raw and red from it. Make sure the external bumper is snug to the skin, but you do not want it pulled so tight that it is causing a pressure on the skin. There are several different types of gastric tubes. I'm going to first start off with the initial tube. This is the first tube that is placed. Usually nowadays most of these tubes are placed via the endoscopic route. The initial tube has a solid mushroom bumper for the internal. It has an adjustable outer bumper. The tube may have a clamp on it. Some come with clamps, some do not. And then they have the feeding adapter. Now with these tubes, when they do need to be changed, usually they're done by a provider because the bumper may have to be pulled out and it can cause a little discomfort and whatnot. And if you're not careful on pulling these out, you can injure the tract. When you have a new tube in, you need to make sure in part of your daily routine that you turn the new tube 360 degrees during the care so the internal bumper does not fuse with the internal linings of the stomach. There are several different types of replacement gastric tubes. The one shown here is a MIC tube. This is a common tube that we do carry at the Copper Queen Hospital for replacement. They have an inflatable inner balloon. They have an adjustable outer bumper. Some may come with multiple ports for infusion of meds or feedings. They come in different sizes, such as diameters. They're usually very easy for insertion for replacement. As a little bit tip, if you're replacing a G-tube with a MIC tube, please remember to close the external ports so you're not wearing the patient's stomach contents. The other type of replacement gastric tubes is called the button tubes. These are usually tubes that are very low profile. Some have a device for installation of the tube. Stems come in different lengths. They may have a solid internal bumper or a balloon that may be filled. The tube that is shown right now is a barred button tube that has a device for installing. You need to use an extension tube while providing feedings with these type of tubes. This G tube that you see here is one that has a balloon that is filled with sterile water, sterile saline. Again, they come in different stem lengths. They must have an extension tube for use. With all button tubes, you need to monitor for weight gain and pressure sores underneath their bumper, because if the patient does put on a large amount of weight, then the stem size has to be changed, because eventually you can have a pressure sore from that G tube. Some tips and considerations you need to be aware of for your gastric tube patient that is receiving feedings. You please remember to keep that patient's head of the bed elevated 45 degrees, especially during and after feedings, to prevent them from refluxing their feedings up their esophagus and having silent aspiration. Frequent mouth care is very important to these patients because their mouth does get dry, they can't drink water anymore, and it can become very uncomfortable. Avoid tension at all times on the tube to prevent changes in the tract. Sometimes tubes get taped too hard against the side of the stomach and it causes an elongation of the tract. Always flush the tube with water before and after feedings to make sure the feeding and gastric content isn't in the tube, which can form a clot. Monitor the patient's intake and output, and also monitor your patient's weight to make sure that they are getting enough feeding to maintain a weight. If they are gaining weight, you need to also make sure that they have appropriate reasons for gaining weight. Are we trying to put weight on the patient because the patient's underweight, or is there something else going on with the patient? When administering medications through the gastric tube, please try to always use liquid forms of medication when available. If you have to use a pill form, please remember to crush and dissolve medications in warm water before placing them down in the G tube. Give one medication at a time. Remember to flush in between medications with 20 to 30 milliliters of water. Flush the tube after medications administration is done. Do not mix feedings and medications together because they may react with the feeding, may cause a clog in the tube. And do not use extended release or enteric-coated medications when you're using a G tube. Crushing these medications turn them into immediate release and you may accidentally overdose your patient. Gastric tubes do sometimes fall out or get displaced, especially after the tube has been inserted for a while, because the stomach acids do eat the internal balloon. If you notice that tube has fallen out, you need to replace that tube immediately. Tracts can close in a matter of hours, even if well established, sometimes even sooner if it's a newer tract tube. Clean the site with soap and water, because sometimes you may have some gastric juices spilling onto the skin and you don't want to cause irritation. Use a water-soluble lubrication on the tip of the replacement tube. Insert the tube through the stoma, inflate the balloon, and pull back until you get mild resistance, so the balloon is up against the entrance of the stomach to prevent gastric juices from going through the tract. Lower the bumper down to flush with the skin to prevent that balloon from moving in and out. You want to make sure it's not too tight again, and then replace the drain sponge. Keep in mind, if you're using a MIC tube, please keep the ports closed when inserting them so you're not wearing the patient's gastric contents again. With the tube displacement, you may check for gastric contents after insertion. You can pull back and you can see if you have gastric contents. Usually the tube is pretty much in the stomach if it's a well-established tract. Do not force the tube through the stoma. If you have problems getting it through, notify the provider immediately after with the insertion problems. Flush the tube with water after checking for gastric content, because you don't want the tube to clog up with feeding and stomach acids that may curdle the feeding and cause a clot. Other problems that you may can have with a G-tube is clogs. Prevent clogs by flushing the G-tube with water, especially after the feedings, between medications, before and after medications. If the G-tube does become clogged, contact the provider. Some of the things that they may want you to do is use Coca-Cola to just try to dissolve the clog. Sometimes you use meat tenderizer and water. If the G-tube is unable to be cleared, they may have you replace the G-tube with another MIC tube, and so you would go through your insertion. Keep in mind that this is the only way for a patient to be able to receive nutrition. So it's very important we protect these G-tubes for these patients. If you have a patient that is on a G-tube that has issues, you need to make sure the provider does know about any issues that they may have. As always, use whatever formula feeding that has been prescribed in the appropriate amount. Feedings can also be done by gravity or by pump. It all depends on what is ordered for the patient. Please keep in mind that your patient with a G-tube is at risk for aspiration, and please make sure your patient's head of the bed is elevated. Thank you for your time today. Gastric tube feedings is a very important skill to keep up on, and I really appreciate you spending some time with me today. Now you will be testing your knowledge, and you will take a post-test to make sure that you retain some important information for this test, and good luck. I know you will do well.